It's my pleasure to now introduce Jennifer Allen. Jennifer is a BC registered social worker with a Master of Social Work from the University of British Columbia. She has over 20 years of experience in both public healthcare and in private practice settings, working with a broad array of individuals and families from diverse backgrounds. Jennifer has specialized skills and knowledge about brain-related health conditions such as traumatic brain injury, concussion, stroke, and dementia. This includes helping people work through anxiety, depression, trauma, grief, and loss, stress, adjustment to health changes, and relationship challenges. She also has advanced expertise helping people navigate complex healthcare systems and accessing community resources. And at Parkinson Society BC, she is our Healthcare Navigator. So I will pass it over to you now, Jen. Thank you for joining us for this webinar.
So welcome, everyone. First, I'd like to just start off with letting you know that the Healthcare Navigation service has been going for about a year now. And one of the things that has come up quite often from the people I've been working with is a sense of sometimes a little bit of frustration, sense of bewilderment sometimes about how to work with healthcare professionals, how to get the best out of that situation. So this is how this whole sort of topic came about. In fact, one person I was working with said, "Oh, you should teach this to everybody." And so I thought, okay, well, it's a good idea, and let's just see how this goes. So this is kind of what I want to tackle today. And you may have thought that, well, I know how to work with my physicians and people, and what do I need to know about this? And the kind of idea I want to get across is to put this this topic, sort of situate it within the idea of what healthcare navigation is. It's just one of the skill sets. And so this is kind of why I wanted to zero in on this particular topic. But before I do that, I'm going to talk about healthcare navigation. I'm going to talk about why is it that we need to be working well with our healthcare providers. The next thing is, like, who are they? Like, who is our healthcare team? On a very practical note, I'm going to talk a little bit about, well, how do you actually prepare for a meeting with a healthcare provider? And then look at strategies for how to improve your relationships, because they're key to your working well with Parkinson's through the journey of it. Particularly as caregivers, you're having to do, or for a lot of you, the bulk of this. And so it's the smoother it can go, the better off it is for your loved one and yourself as well. And then the last topic is really just looking at, okay, well, what if it's not going very well? Like, what do we do? So that's kind of what I'd like to tackle today. So the first bit is, what is healthcare navigation? Often my very first contact with people is I explain my role. I explain what it is I'm doing, the breadth of my role, and the general sort of the core notion is the ability to understand how systems work, figure out what information you need to know to access the system and to communicate within the system, because that's a complex thing in and of itself, so that you can get the services you need in order to have good care for yourself and others. That's in essence what healthcare navigation is. It's a very complex topic because there's many parts, and it involves lots of different skills and knowledge. So I've kind of suggested that, and strategies. How do I how do I maneuver? And so partly this is about helping you build some skills and strengthen the ones you already have. Some of you may be doing all of this already, which is fabulous. This will reinforce it. And of course, as a lot of you know, it takes incredible patience, and you have to keep at it. You have to persevere. You have to persist with when you're trying to access services and entry into healthcare systems. So this model is, I just really like it. It kind of encapsulates a lot of the skills that are involved in healthcare navigation. And as you can see, there's different levels at which to look at systems. And so part of my work in healthcare, many years of working, is understanding systems and figuring out how to work my way through them. So what we're going to focus on today is just the bit I've circled in red, and that's just on the interpersonal level, the interactional level, because this is something that as caregivers, you can actually do something about. So that's one of the reasons I wanted to focus in on this. And so when you look at healthcare navigation, they've kind of these particular group of researchers, they have kind of broken it down to access, understand, appraise, and apply the health information. So figuring out how to get in, understanding how it works, figuring out, is this going to work for me? Is this the right place to be? Is this the right set of services or resources? And then being able to take the information that you get and apply it in order to get the best care and the best service for you as well as your loved one. So this is generally just trying to help you to understand that systems and healthcare systems, they have different levels. So there's the big picture, the middle picture, which is the level of the organization, and then there's the small picture. And I'm not going to spend too much time kind of focusing in on what's happening at the system level. But if you think of healthcare systems, often what we think of is hospitals, right? We think of all these different places we have to go to get healthcare. So there's this big giant system, and we have to figure out what is the system, what is its purpose, how does it function? What does it even cost to get access or get service? And what are the rules? And the middle level is looking at kind of, okay, so within the hospital and within a healthcare, there's different places. There might be the place where you go, you have to go to the podiatrist because you need foot care. You have to go and get x-ray because you have to get an MRI, or you need to go to home care. So at the middle level is kind of all the parts. And at the small picture level is the level at which we interface with systems. And this is the level where I wanted to focus on today. Okay, so this little chart here I did was just kind of a picture to make it more understandable and to sort of provide you some rationale with why am I focusing on this small picture. It's because systems do change, but they change slowly. And for you, you're just trying to figure out how to get home care, how to figure out long-term care. The overall change is making change or trying to interact at that large level is much too overwhelming, and it takes time and energy. The middle level, so as I said, like there's organizations within the larger system, and then at the sort of immediate level is where we interface and interact. So it's as simple as phoning up the doctor's office. I mean, that's an interaction we're having with the healthcare professional. It could be how we, when we're having a physio appointment, or, we're taking our loved one to a physiotherapist, and that's the interaction, and how do you make that session go well? So what I've identified here is it's through human experience that we can, and changing the way we do things, that we can actually be the most effective. And that's kind of why I think this is an important thing to talk about. Okay, so why do we need to do this in the first place? Like, aren't we doing it anyways? Like, what's the issue here? So as you can imagine, this is some, as I said, this is something I hear quite a bit from the people I'm working with. Frustrations, accessing services, how to do it, what's available. There's reasons why it's important to have good relationships with healthcare professionals. And that's because they are often the ones we're going to for diagnosis, treatment, and care, intervention. They're a significant part of your healthcare team, and your as care partners, your loved one's healthcare team. They often healthcare providers are kind of like the gateway to other services and systems that you may not know about. And sometimes you cannot access those systems without a referral from that particular healthcare professional. So it's really important to have a good relationship with them so that you get the information you need, and they will make the appropriate referral and follow up with it. The other thing is your healthcare providers, many of them, not all of them, will have specialized knowledge about Parkinson's disease. This is crucial. I mean, part of what you're doing as caregivers, you're going through this process, and there's so much to know. It changes continuously, and the resources and the services change with the trajectory of the illness. So there's so much knowledge, and one of the sources of knowledge is your healthcare provider. So they can help you figure out and make recommendations about what's available, what you might try, what are the options, how to get the best care for your loved one. And you rely on them. You rely on them to help you through this process. And it's already daunting enough. And so we need to have the support of our healthcare professionals in order to help us through. So this kind of refers to the couple of slides before. So healthcare professionals, the reason why it's important to have good relationships is they help with access, they help with understanding, they help you understand about the disease, about different resources, about treatment plans, all sorts of different things that you or your loved one might need to know about. They help you figure out, because one of the things that's very daunting with healthcare is to figure out how to make sense of the information that's provided to you, and then the next thing is how to then apply that information. And all of those things together, that gets you the best care, which is what this is all about. It's all about getting the best care for your loved one. And as care partners, this is one of the focuses for your life, particularly at the moment. And so, most of you are like, you're doing everything you can. And so the more that you understand how it works, the better, hopefully, the better that makes it for you. So who are we talking about? Anyways, who when I'm talking about healthcare, who are they? And so I kind of look at this in a very, very broad way. We tend to think of them as like the doctors and the specialists and the neurologists and the movement disorder specialists, people like that. But actually, it's super broad. they are, they are physios, they are the home care occupational therapist that comes in and does a home and safety assessment. They might be a speech language therapist who is assessing about swallowing or giving you, you might, go to one because you need a swallowing assessment and they will provide recommendations. They are your neighborhood pharmacist. Hopefully most of you have a pharmacist that you can go to and ask questions of, because a good pharmacist is extremely important. And they are dietitians, because you need people to talk to you about, nutrition. Your dentists, psychologists, psychiatrists, social workers, people like me, counselors, home support workers. Home support workers, sometimes they're the main healthcare provider we're interacting with on a daily basis, or at least on a weekly basis. And people like care aides or any respiratory therapists. There's all types of healthcare providers. So the notion here is to think of them as your team. They support you and your loved one through this process of working with Parkinson's disease. And I'm borrowing from It Takes a Village. So to me, it takes a team. It takes a team of skilled professionals and relationships with those skilled professionals in order to support not just your loved one, but you through the supporting them through Parkinson's disease. It's often it's something that you're involved in for a long time, and it changes over time. So it's really important to have the supporting cast around you, because you need them. And that's what I often say to people is, you got to work on this relationship. You need them. You don't have to like them, but you need them. And even if you're only going to see them once a year or once a month, you need them in your corner. So that's kind of it takes a village. It takes a team to support us. So this slide, this actually comes from the Parkinson's website, and it's just to help you kind of get a sense, if you don't already know, all of these different healthcare providers and generally what their roles are. Because part of getting working with them is kind of getting an understanding, and I'm talking about general, about what they do, so that you can know who to go to for what. So this is just a resource for you. This is on the Parkinson's website. It lists all these different healthcare professionals. It's really quite a good reference point. So that's why I put it in there, in case you're not clear about, well, what does an occupational therapist do anyways? Why is one coming to my home? Why is the community, sending one? And actually, as I'm talking, I realized I didn't put case managers or anything else, but they're also, they're some of the healthcare providers you're dealing with more often than not. So this next slide is really just the next sort of segment about kind of the practical side of dealing with healthcare providers. And because this is the kind of thing that as Healthcare Navigator, this is kind of thing I've been doing quite a bit with people, is helping them get the most out of their meetings with healthcare providers. They express frustration. And so we spend a bit of time. I help them prep for the meetings. And the whole idea is to think about it in a certain way and to, to build some skills. And then this is what you do sort of every time you have a meeting. So what's really important when you're meeting with healthcare professionals is you have to, obviously you've made an appointment, or there's an appointment for a reason. Maybe it's just about medications. Maybe it's, maybe you're meeting with the family physician about nothing to do with the Parkinson's, but you need a flu shot or something like that. But there's many reasons why we're working with or making appointments with healthcare professionals. And so what's really important is to kind of keep track of the information, which is why I kind of focus on like having a notebook. People hear me say this over and over again, like have a notebook that you keep all your health information in, and take that notebook with you to every appointment. And in that notebook, figure out, okay, what is it that I want to get out of this meeting? Take a bit of time before, because often we're having to book these meetings weeks, if not months in advance. So before the meeting approaches, take some time to figure, okay, what do I need to get out of it? It may be just simple as renewing your prescriptions or renewing your loved one's prescriptions, or discussing changes in symptoms or new symptoms or other things that are going on. So you have to take some time and figure out, okay, what do I want to get out of this? Write it down, because one of the things that happens when you're in there with your physician, and particularly if you have to do it over the phone, is you forget. You're so busy, because you've got like 5 minutes, if that, and you're a bit anxious, and you've got this long list. The best thing to do is just to write it down, write your concerns and questions down. One very important strategy is physicians prefer that you do 1 or 2 topics. Some of them will even say, I will only tackle 1 topic per time. If you're going in to see, say, a physio, you have a little bit more time, so you can talk about your concerns. So the number of concerns that you raise will depend on which healthcare professional you're dealing with. So you want to list your priorities, and then you want to kind of do your top 3 or your top 1 and set your expectations. So, okay, what's the most important thing for me to get out of this? Well, I need my scripts renewed. So, and if you have to make another appointment to do the other things that are on your list, then that's a good strategy. So I have here kind of this idea about understanding their role. And that kind of refers to the slides before, where if you understand what their job is, then it's really important to stay within what their job is and don't ask them questions. So for example, a really good example is if you're having a tough time and you're looking for emotional support, it's best to talk about that in terms of, if you're concerned about anxiety, depression, bring that up. But to be really clear about who you're talking to, what about, because if you ask, I would not be asking my pharmacist about, emotional support. That's not their scope of practice. So I would talk to my counselor about that, or I'd talk to my mental health professional about that. So it's really important to be clear about what it is that you want and make sure it's within their role. You may notice sometimes that, if you ask questions that are outside what people know, you don't have as positive an interaction, because unless they can say, sorry, that's not what I do. From your point of view, if you can stick within what you understand their role to be, you're going to get better service. So after you finish with your appointment, so there's sort of the before preparation, the during, so when you're talking to them, and the afterwards. So when you're in the middle of the appointment, you're probably, if you have the opportunity to take notes, sometimes there's too much going on, then do so. Sometimes if you're getting overwhelmed because of the information that's being provided, you can slow it down by taking notes and asking people to repeat things and so on. So if you have the time, and sometimes that won't be till you get home, right? you just summarize what was discussed, any recommendations, and then think about, okay, what do I have to do to follow up? So it might be, well, I have to, maybe the scripts are being faxed to the pharmacists. Well, that's great. So that you might have to go pick them up, or they might be delivered or whatever. So think about any questions you might have had coming out of that conversation and whether you need to book another appointment. That's just a really practical approach to any, and I'm not just talking about physicians, any healthcare professional. You want to prepare yourself, have your questions, what you want to get out of it, and then whatever follow up. And that's a good way to approach it. So this is, again, this is pulled from the Parkinson's website. It's a really good checklist. So sometimes, and I'd say particularly for professionals where you don't see them very often, like your neurologist, and it helps you to think of all the different things that you might, your loved one might be, having challenges with. And it kind of reminds you, oh yeah, okay, what about swallowing? What about, being able to get dressed? What about, how's the mood? Are there any cognitive changes? So this, if you don't already use this checklist, it's on the website and it's really good. It helps you to stay focused and remind you what it is that you need to get out of that meeting. Often the neurologist meeting, particularly the movement disorders, those can be a little bit longer. So you would have time to get into it. But this as a basic guideline is really, really good. It's very well put together and it's a good resource for you. You can see how things change over time. Maybe there was no communication difficulties last year, but this year you're noticing voice, or you're noticing, choking on food, or you're noticing the tremor is getting worse, or maybe there's a pain component, or you're noticing shifts in the mood, or anxiety is a stronger component of, what's going on. So it's just a really good guide, and that's why I put it in there, and it's on the website if you don't know about it already. This is also from the website. It's just, again, a really good tool. It helps you just to focus in on what it is that you want to get out of the medical appointment. And it kind of presents it in a format that's easy to look at. And so sometimes, when you need to get your prescriptions renewed, and you got to remember what they all are and the doses and everything, because sometimes they'll ask you, well, the number of milligrams or whatever. Some of them do, some of them don't. So just to have that in front of you, and some of these other cues, like just generally how it's going, what are the physical issues, and some of these secondary issues. And I don't mean secondary in terms of their importance. Sometimes mood, sleep, and anxiety can be the most prominent presenting symptoms. So again, this is just a really good guideline. You could just prep. You could use it in your prep if you want to. Just a really good resource for you, and it's on the website. Okay. So the next piece is, how are we doing for time? Oh yeah, I'm talking a lot. 11:30. Okay, so this is kind of let's get to the nitty gritty. What to do if it's not going so well? If you're feeling frustrated, if you feel that, what I hear from people a lot is, and I'm focusing on physicians, probably because the physicians have such a prominent role on our healthcare teams, and they're not getting what they need out of the appointment. So this comes up in their conversations with me. And so what are some of the issues? And I've just listed a few of them. So what people, they feel frustrated, they feel like they didn't get what they needed, that the person's not listening to them. So it's just a general feeling about the experience with the healthcare provider, that is uncomfortable. And also disempowering. It makes people feel like they're not on top of things, and that's not a lot of fun. So um, maybe you feel that you've discussed something with your healthcare provider, but they haven't made a referral or followed up for you. That can happen. Maybe you need referral to another healthcare professional. Like maybe you need to go see like an endocrinologist or some other kind of professional or an internal medicine, or you need some other intervention. Maybe you need psychiatry, or a physiatrist, which is a rehab doctor. Um, Sometimes what's very challenging, people say, is I hear different things from different healthcare providers. Somebody's telling me this and this person's telling me that, and they're kind of not communicating. And what am I supposed to do about this? And so, and that is very, very frustrating. And so part of what I do with this is, like, I talk about, well, they're going to come from different perspectives. So that's why they're giving you different bits of information. This is what this person's role is, and this is what this person's role. And so it's about figuring it out from there. But dealing with the different points of view can be pretty challenging. Sometimes it's just plain difficult to communicate. And sometimes the information is really overwhelming. You're not really sure what they're talking about. Some healthcare providers are really good at sort of presenting information in a way that's understandable and doing it in a fashion which allows you time to take it in. And sometimes the issue is just a lack of consistency. If you're somebody who doesn't have a physician, so that's, as we know, that's a problem for many people. And it's something I get asked to help with. Not that I have a lot of brilliant ideas, but definitely we have a look at it. Depends on the community. Maybe they're going to see a different physician at a clinic every time. Like it's really a challenging thing. So these are just some of the challenges that can happen with healthcare providers. I'm sure there's many more, and I'd love to hear about. I'd love to hear you talk about like what challenges you're having and what solutions you found to deal with those things. Okay. So this is the crux of the whole conversation today. So what are some strategies to help you in this endeavor to have good relationships with your healthcare providers? And just to even think about it that way, to think about every person you have contact with, and it could be a 5-minute contact and you never see them again. Like that's true of home support workers. If you're accessing the public system, you're going to have this continuous rotation of, like, maybe there's 30 different people coming in, and it's so the interaction might be as short as 5 minutes or 15. So, but to think of it in terms of relationship and relationship building is a really, really important concept. Okay. So again, this is just meant to be helpful, and you're probably doing a lot of this already, but if you're not, here's some good ideas for you. So one of the things I find, and I came up with this in my own situation. I have an elderly parent who has home support coming in, and we were talking about, like, how does she make it work for her every time that somebody comes in. And so to just to kind of go into whether it's the visit or the appointment, just go into it with a focused, relaxed way of looking at things. To kind of referring back to the meeting with the appointment is, if you know what your purpose is, then you're clear about your expectations, you're going to get you're likely to it will be more likely those expectations are met, or some of them. Understanding their role and what is not their role is probably key, and how to, how to talk to them effectively so that you get, what you need. And it's really important with healthcare professionals, if you don't understand what they're saying to you, ask them to explain it again. Ask them if there's just a piece you don't understand, because there's nothing worse than having a conversation with somebody. It's like, because what happens to us when we get anxious, like it just doesn't go in. So so they can be saying all this really helpful stuff, but like, it happens to me all the time, and I do this for a living. I go in there and I'm like, okay, this is what I want to talk about, and then like it just goes out my mind. And luckily I have my notes in front of me, so I go, oh yeah, right. And even if I have my notes in front of me, I might get distracted by something, or they say, okay, gotta go. So ask for clarification if you don't understand something. And this last little bit is just meant to help you with relationship building. It's like, um, if, and I'm just saying, if you have the capacity to a little bit put yourself in their shoes, like most people are really busy, they're doing their best, and um, that will help you in your relationship building. Okay, so this is just a framework that's just really quite useful, and it's all to do with how to have effective communication with physicians. Is primarily where this came out of. Again, this is on the Parkinson's website, and so the acronym is PACE. P is for present. So think of when you go to the physician. And this, again, you can use this with any healthcare provider. When you go to the physio, when you go see the speech therapist, when you're talking to the dietitian, you want to present health information that's concise. And the reason it's because you've been keeping track of it in your health notebook. Ask questions. So you want to go in with specific questions and narrow it down. You want to check. So C stands for check the information that the person provided to you. So it's just like a reflective response to just say, you said that, okay, I need to do these and these stretches in order to help with this, or I need to take my medication at this time, this time, and this time. And the last one, E, is if you have any concerns or queries, express them to your physician, because part of the challenge is they're going to make recommendations based on the diagnosis and their assessment of the symptoms that are being presented. And if you have any concerns about it, it's really important to be able to express that to them. So this little acronym can be quite effective, and you can use this in a really quick or shortened form with any healthcare provider, not just your physician. Okay, so what I thought might be useful at this stage of the game is kind of just talk about these really common scenarios that get brought up to me, or that people have to deal with often. And when you have Parkinson's disease, you have to see a lot of physicians, and so it's just a common one. So imagine you got your, many of you and your loved ones, you're lucky if you see your neurologist once a year. Some of you might be seeing them, and in some places, they don't have if you live in rural communities, they might not be a neurologist, and you might have to travel. Or it could be a big deal to go and visit a specialist physician, or any physician, depending on where you're living in BC. And some communities have physician shortages, like Victoria has a huge physician shortage. So when you're visiting your physician, it's usually a big deal, and that maybe it's not a big deal because you're just going for a flu shot, but often it's going to take a bit of time and time out of your day. So you're going to see the neurologist, you've been waiting, you want to get have a good experience, you want to be able to discuss the concerns your loved one is having, or they discuss their concerns, whatever the scenario is. So these are just kind of like some ideas, and some of this might be a bit of repetition, but think of it as you want to think about the visit you want to prepare. Like for some people, going to visit a neurologist is like a whole day affair. Because they have to get there. They may have to go there and stay overnight, and then go the next morning, and then get home. So, the meeting feels even that much more important, because it's involved. Like you have to do a lot of things to get to it. So you want to think ahead and get ready, particularly for these types of appointments where you just don't have easy access. Know why you're going. I mean, often with if this is a new diagnosis, this might be your very first meeting with the neurologist or the movement disorder specialist. And if you live in a community where maybe there was one and now there isn't, and now they found a new one, it might be your first meeting with that particular person. So, and the way that person runs the appointment might be different than the one before. So you want to go in like clear on what you want to get out of it. You have your questions prepared. It could, as I said, it can be an anxiety filled meeting. You may even find that just the practical job of getting your loved one ready for such a meeting, because of transportation, medications have to be timed properly, all this kind of stuff is very involved. So that's why it's important to make the best of the time you have available, and do a little bit of planning and preparation, and then you'll get the best out of it. So what you also want to do is you want to if you go into a meeting and it feels like things are rushed, you want to slow it down if you can. And you want to be able to, if there's an issue that they can't deal with, and they say, look, we're running out of time, or I can't do that, figure out a way of how that could be addressed. Could there be a follow-up somehow by phone or whatever? So it's really important with healthcare professionals. They're people too. They have egos. We all have egos. And it's nice to be appreciated. So just think of yourself when you're approaching these relationships with healthcare professionals. These are service providers. You want to have a good relationship, and you want to be polite, open, and appreciative. And it's going to get you a long way. And this is something I learned from my mom. She is, I see her with the home care, that she tells them what she needs. She says, she thanks them every time. And that is the way she gets the best care. And this is what this is all about. So the next scenario is, again, a very typical scenario, home support. So you may not be at that place yet where you've got home support coming in, or you may hire your own people. Doesn't matter whether they're publicly funded or privately funded. There are people who come in to help with your daily function. And it's really important to have to make it work for your loved one. And one of the challenges, of course, with home support, it depends on your loved one, is they might find it quite difficult to have somebody coming in from the outside, and totally understandable. And so it might take time to build these relationships so that they get to know people. And some people opt for looking at private support, because having a rotating, group of multiple people coming in just doesn't work for their loved ones. So a more consistent approach is, and if they can afford it. Okay, so similar kind of, so this is what my mom tells me. She says, when she knows, because oftentimes you don't know when they're coming. It's a window. So she's ready. So she's talking about she's ready mentally and physically. I suggested to her, because she, that she make sure she understands what the care plan is. And so the care plan is that plan that the case manager will have come up with. And it should be, you should have it in your home. But it will tell the home support workers what they can and cannot do. So if you ask them to do things that aren't in the care plan, they won't. They often, some of them will, but many of them are say, look, we that's not in the care plan. We can't do it. If there's things that need to be in the care plan, then you need to talk to the case manager and have them added and see if they will do that. So, okay, home support workers coming in the morning, maybe you need help getting dressed. So so the getting ready part might be figuring out what you're going to wear so that you don't spend time doing that. Okay, could you please, help me get dressed today? Because often they come in and they say, what can I help you with? Then you ask them. Really important to, and as care partners, you will be facilitating this probably quite a bit, depending on your situation. Clear communication. Sometimes you're working, well, I'd say sometimes, probably a lot of the time, you're working in the home support field. There's a lot of people who English is not their first language, and they are, so the communication, it's not that they're not understanding, it's just different, cultural communication, ways that we have. And so it's important just to communicate really clearly and simply and understand that they are carrying out a job. They are part of a huge system, and there's multiple players in their system. So they have a manager, there's a case manager, there's somebody above them. So they are carrying out a role, which is part of a larger system. And oftentimes what people say to me is, well, they're here for 5 minutes. Like, they tell me I have like half an hour, but they're in and out. They're always in a rush. And part of that is not their fault. It's how the system is structured. So as well as you can, because we can't always be patient. Be patient. They're doing their best. Some of them are better at it than others. And then just to be appreciative. And that way you'll get the best care. Okay, so what has this all been about? What are my main takeaways here I'd like you to take away? So to see that interacting with effectively with any healthcare provider, and just see it as really anybody who's providing, you're interacting with them and providing services and assistance, they are part of your team. And they're an essential. Communicating effectively is essential, because that's the best way to get the best care. So good relationships equals better care. And a little bit of planning goes a long way. So planning, organizing, and communicating. These are the key strategies to focus on when you're looking at making things better. If things aren't going well, then look at those things and see if you sometimes even just a little bit better. Like my mom talks about some of the home care that it's a little bit harder with, and she works really hard to try and make it a little bit better so she can get better care. So those are the key things to focus on. And I think that is all I have for you. What time is it? Oh, yeah, see, I talked a long time. I'm open for questions, and let's open up I'm going to stop my slide share. There we go. I'm going to open up the chat. Okay. I'm just looking at the chat and some of the questions. And feel free to unmute yourself and ask any questions. So, somebody asked me if I'd post the links to the PDFs, and absolutely we can do that. How do you get the case manager is another question. Very, I mean, I'm kind of making assumptions about what this question means, and the how do you get a case manager? I think that's how I'm interpreting it. And that's a challenging thing. So if you're in a situation where it depends on your situation, if you have home support coming in, there should be somebody who's case managing, because there has to be somebody overseeing that and putting together a plan. So on a really practical point of view, and I know this varies from health authority to health authority. So, if you're in Vancouver Coastal Health versus VIHA on the island versus Fraser Health, getting access to some of these players is not always, it's not the same as in other health authorities. So, the first thing to do is to ask if you can, you request an assessment of your loved one's needs, and request, and if I'm already, if my question is, if I'm not answering the question, I'm sorry, ask for it and see what happens. And if they say no, ask ask them how does one get a case manager? And so it's a matter of, and sometimes this takes a little bit of persistence. So I don't think I've answered that. It's a longer conversation. Feel free to contact me if I can help you with this. Please, the links. Can you help me with that, Alana? The links to some of these documents?
If you have them, you can just paste them in the chat box.
I don't. Okay. The problem is that would take me a little bit of time, and I would be having to do two things at once. And
or you can just send me the links, and then if somebody contacts me, I can forward it to them.
Okay. Is that okay? I hope that's okay.
So I'll write my email in the chat box.
Okay, perfect. The other thing, so the other thing was the links would be on the PowerPoint, which will be posted. So that would be the other thing. The question is about where are the healthcare team members and prep. It's in the resource material. Hang on. Just trying to work my way through the. So Catherine's asking, where are the healthcare team members and prep questions kept on the website? They're under the resource section. If you go in the resource section, you'll see all sorts of categories about different things to different bits of information. And one of the things I am not very good at is remembering where it exactly it is. I would have to look it up myself and tell you. So what I could do is I could copy all these links, put them in an email, and then Elana could send them out if that helps everybody. Okay. Kent's asking, what if they are belligerent and won't go for care? Or I'm assuming you're talking about your loved one. what to do about that. I'm not sure what that question means. And if you want to speak to that, Kent, to help me to understand a little bit better what you're asking. Oh, okay. Don't forget, yes, spiritual care providers, you're absolutely right. I don't think it is on the main list, is it? You're suggesting there that it needs to be added, and you're absolutely right, because it's an important, and probably the list isn't exhaustive. So, let's see, there's a few more comments. Okay, so to help you with all of the resources, somebody's looked it up, self-management under resources. Yes, support groups are an excellent resource for helping out and sharing information and pointing one person to a set of resources or way of sharing strategies for how to deal. Really good suggestion. Oh, so Kent, you're talking about your father. So I'm kind of assuming what you mean is if they won't get, I'm going to suggest, Kent, that you actually contact the Parkinson Society and ask for a referral to me, because this sounds like you might, even if we had a conversation and I could let you know if I can help you, that might be a good idea, because I'm not sure if I can address that here. I know if you're willing to do that, but because it sounds more involved and I'm not don't feel like I have enough information to give a good answer. If you request, Joanne's saying, if you request assessment from home care, why would they say no? Because they might not say no, but they might say it's going to be a while. And they might ask you what the issues are. And they might say, well, we only do personal care. So it's not an easy system to navigate, the home support, the home and community care. And what I'm finding is it really depends where you live. And so it just even getting entry to it can be challenging. Not just that, but navigating it as well. Please include an email. Did I answer all the questions as best I could? Yeah. Gail says, this isn't specific to healthcare professionals, but my husband and I have found participation in Parkinson support group very helpful and educational. Yes. So, yes, I think kind of what you're saying, Gail, is you're talking about kind of at the grassroots, which support groups are, the sharing of information between people who are kind of in the same boat, going through the same thing, it's so helpful, not only from a practical, but from an emotional support point of view. Even just hearing somebody else's experience, what they're dealing with, tips and strategies shared, it's invaluable. So I totally support that. What are those last things? Do you need a referral? Joanne's asking, do you need a referral from your physician to get to? No, you don't. You can have, if your physician's willing to do a referral, great. It doesn't have to be physician generated. Anybody can phone up and request a home care assessment. What you'll find is that they have a priority system. And so the first priority for them is people being discharged from hospital. So they have a priority system. And so it can take a while if you're if you're making a request from your own community. So yes, you can. And it is something that if you can get your doctor on board, go for it. Like, and also the doctor needs to know that's where you're at. You know, having them discussing home support with them, having them on side, getting them to support I will often say to people, if your doctors, you can get your doctor on side, like that's the best case scenario. So they also need to know that that's where you're at. It's part of their ability, you know, their continuity of care for you. Yes. Okay. So Catherine found it. Thank you, Catherine. It's under, the checklist is under preparing for a medical appointment, and your healthcare team members' PDFs are found under self-management on the website. So Catherine found it. Good for you. Way faster than me. Yes, the Aware and Care Kit, I think, is in the same place as under self-management. But if it's not, I'll have to check afterwards. But you know what your chat's telling me, I really should have had a list. So that's just a good bit of feedback for me. Oh, thank you, Catherine. Go to resources and then healthcare professionals, and then you find all these things. Oh, how do you get, so you can download the kit, I believe, please somebody correct me. You can download it, or you can ask for it to be sent to you, I believe. So if somebody knows differently, please correct me. And Alana, you may know differently. But it's an excellent resource, another excellent resource. There's just some really good stuff. Anything else? Did I answer most of it? I hope so. So this was kind of the first time this presentation has happened. So any feedback, like fire away, because there's ways I can improve it, I'm sure.
Well, I think those are all of our questions. Jen, I want to thank you so much for taking the time out to do such an informative presentation for us. And thank you all for attending and all of your questions. And there's some comments here for you as well, Jen. Thank you very much. Have a good afternoon.
Thank you very much for participating. I really wish I could see your faces. It'd be way nicer, but this is just how we do it, right? Oh, Catherine has said the kits, the Wear and Care kits, the are at Parkinson. So you probably can get it mailed out to you if you want to, like a hard copy. I think you can download it too, though. Well, we didn't cover, no, we didn't talk about private services. No. Yeah, it's a kind of a whole nother ball game, isn't it? Maybe we need to do another presentation on that kind of topic. Thank you, everyone, for your participation. Oh, great. Catherine, you are so on it. She's even got the contact stuff there. Okay, I'm going to sign off and say thank you. Bye.